Union Home Ministry writes to all states and union territories to ensure compliance of the Supreme Court directions on welfare of migrant labourers housed at relief shelters, availability of essential commodities under control as several ministries work in coordination with state governments to resolve logistical problems. Union Health Minister Dr. Harshvardhan holds a review with Council of Scientific and Industrial Research through video conferencing about the steps undertaken by CSIR and its constituent 38 labs towards mitigation of coronavirus outbreak in the country, says CSIR scientists to develop COVID-19 mitigation solutions, keeping fixed time frame in mind. Active COVID-19 cases across India rise to 7,987 with 308 fatalities and 856 recoveries. Government focuses on increasing testing facilities, says no need to panic as the government is planning things so as to effectively manage the situation. Number of coronavirus hotspots in Delhi goes up to 43 with a few more localities added as containment zones, high-risk zones and containment zones to be sanitized from today in the national capital. COVID-19 cases across the world continue to spiral up. Over 18,45,000 cases registered globally with over 1,14,000 deaths. US President Donald Trump signs presidential disaster declaration for all 50 states in wake of COVID-19 as US records 1,514 virus deaths in past 24 hours. UK Prime Minister Boris Johnson discharged from hospital. Good morning. Hope you're doing well. I'm Shubhendu Ghosh. India's response to contain COVID-19 has been proactive and the government has followed a graded approach to deal with the situation, focusing on increasing testing facilities. The government has said that there is no need to panic as proper planning is being done to effectively manage the situation. Further, in coordination with the states, the centre is ensuring supply of PPE, N95 masks, testing kits, ventilators and dedicated COVID hospitals are also being set up to provide proper treatment. The figure of active cases has risen to 7,987. 308 deaths have been reported. 856 people have been cured and discharged so far. In view of the Supreme Court's directions regarding welfare of migrant labourers housed at relief shelters and camps in different parts of the country, Union Ministry of Home Affairs has written to all states and union territories to take necessary action in compliance of the directions of the court while implementing lockdown measures to fight COVID-19 effectively. The court directed that adequate medical facilities besides proper arrangements for food, clean drinking water, sanitation be ensured for migrant workers at relief camps, shelters across the country. Further, trained counsellors and community group leaders belonging to all faiths should visit the relief camps, shelter homes and deal with any consternation that the migrants might be going through. The court also observed that anxiety and fear of migrants should be understood by the police and other authorities and that they should deal with the migrants in the humane manner. Health Minister Dr. Harshvardhan yesterday held a review meeting with the Director General of Council of Scientific and Industrial Research, Shekhar Mande, and all the 38 CSIR lab directors. During the meeting, Health Minister exhorted scientists to develop COVID-19 mitigation solutions, keeping a fixed time frame in mind. He added that these are times of war and we need to deliver solutions before the war ends by not treating this as a routine research project. Dr. Harshvardhan said genetic sequencing was crucial in eradicating polio and it will help in COVID-19 mitigation as well. During the meeting, CSIR DG said a core strategy group has been set up and 5 verticals have been identified under which coronavirus-related activities are being carried out. These include digital and molecular surveillance, rapid and economical diagnostics, new drugs, repurposing of drugs and associated production processes, hospital assistive devices and PPEs, along with supply chain and logistics support systems. Dr. Mande also mentioned that 15 CSIR labs are working in close partnership with major industries, PSUs, MSMEs and other departments and ministries at the time of crisis in the country. The Health Minister appreciated that CSIR labs were also conducting tests of swab samples of coronavirus patients, and some of them have started doing genetic sequences of the virus with target of doing 500 sequencing in the coming weeks. He also appreciated the work done by CSIR NAL with BHEL and BEL on ventilators, oxygen enrichment devices, and also are developing 3D printed face shields, face masks, gowns and other protective equipment, adding that all these things will help in the next few weeks. Meanwhile, in the daily briefing, Health Ministry and Home Ministry shared the updates for Sunday. Ministry of Home Affairs Joint Secretary Punya Salila Srivastava said that the government is working with states to ensure door-to-door delivery of essential commodities. She said that curfew passes are being issued for suppliers of essential goods. She mentioned about Cyber Dost, a portal to tackle cybercrime, especially financial crime, has been launched since there is an increase in online financial transactions these days. Health Ministry Joint Secretary Lava Agarwal said that 80% cases are mild and asymptomatic and are treated at COVID care centres. 1,05,000 beds are available for COVID patients. Number of hospitals and isolation beds are also increasing every day. 500 beds dedicated at Safdarjung Hospital for COVID-19. 444 additional ventilators have been provided in Andhra Pradesh. 1,200 beds dedicated hospital is available in Ahmedabad. Private hospitals like Apollo and Max Hospital have also made arrangements for patients. Meanwhile, ICMR said that work on developing the vaccine is also underway, and 40+ candidates vaccines are under development. And similar to phase 1, where 5,000 coaches of railways had been transformed into isolation wards, in phase 2, 20,000 train coaches will be transformed into isolation wards. The Delhi government has identified 3 more areas as containment zones in the capital. The number of containment zones in Delhi now stands at 43. South-East Delhi has the highest number of 12 containment zones. East Delhi has 9 coronavirus containment zones, followed by Shahadra at 5 and West Delhi at 4, while South and Southwest and Central Delhi have 3 containment zones each. New Delhi and North District each have 2 such zones. Mahavir Enclave is amongst the latest neighborhood to be declared as a containment zone. The total coronavirus cases in Delhi has risen to 1,069. This is according to the latest data from Ministry of Health. 19 people have died in the state so far from coronavirus, while 25 people have been cured and discharged from hospital. In view of the announcement of several containment zones by Delhi government, Operation Shield is being implemented in these areas. This exercise is being expanded to cover more areas based on the need. High-risk zones and the containment zones will be sanitized from Monday using high-tech Japanese machines. And Delhi police has appealed to people to cooperate with the authorities by staying at home on the 2 upcoming festivals of Baisakhi and Ambedkar Jayanti.
जो आने वाले 2 फेस्टिवल हैं, एक वैसाखी है और एक अम्बेडकर जयंती है, इसमें तमाम जो लोग हैं वो घर में रहें और बाहर ना निकलें और लॉकडाउन को इम्प्लीमेंट करने में दिल्ली पुलिस का सहयोग करें, जैसे आप पहले सहयोग कर रहे हैं। मैं आशा करता हूं कि आपका सहयोग हमें मिलेगा। इस लॉकडाउन के दौरान किसी भी सोशल रिलीजियस फंक्शन की सख्त मनाही है और इन दोनों फंक्शंस के लिए बैसाखी और अम्बेडकर जयंती ये आप घर में ही रहें, बाहर ना निकलें और दिल्ली पुलिस का लॉकडाउन को इम्प्लीमेंट करने में सहयोग करें।
Now, from early detection to curbing COVID-19 from spreading further, several districts have been adopting innovative models for the same. Agra model has emerged as the best model so far for successfully tackling the cluster containment. The state, district administration and frontline workers coordinated their efforts by utilizing their existing smart city integrated with command and control center as war rooms. Under the cluster containment and outbreak containment plans, the district administration identified the epicenters, delineated impact of positive confirmed cases on a map and deployed special task force as per the microplan made by the district administration. For reaching out to people, central helplines were established and a multifunctional team was set up for coordinating responses. The cluster containment strategy adopted by Agra is being shared with other states as a best practice. In Bengaluru, Department of Health and Family Welfare, Karnataka, shared a very impactful visual with positive message. A team of doctors joined together in thunderous applause to give a farewell to a COVID-19 discharged patient. The team of doctors at the KC General Hospital in Bengaluru were seen clapping joyfully as they see off the patient who had recovered. Doctors wished him well, cheered him and presented a bouquet and reached out to him, bidding a smiling farewell. And this is the spirit of the doctors treating COVID-19 patients. The patient clearly was overwhelmed. In their efforts to curb the spread of novel coronavirus, All India Institute of Medical Sciences, Rishikesh, has come up with a new device and software to detect and create awareness about symptoms related to novel coronavirus. The software that can be downloaded in the form of an app will connect the person directly to the database of AIMS as soon as he or she fills his or her details, upon which the app will provide necessary health provisions based on primary details filled by the user. In addition to the software, a device which can either be worn on wrist or on waist will enable the physician to monitor the patient's health on timely basis, as well as the device will also help in commuting the patient through an ambulance when and whenever the need arises. The soon-to-be launched software and device has been developed by Bharat Electronics Limited, that's BEL. And with the novel coronavirus outbreak, people are practicing quarantine and are stuck inside their homes. This is being done as social distancing is the only way to combat COVID-19. However, to deal with the situation, many have started engaging themselves in fun and other creative activities that also involve spending time with loved ones. It seems National President of Lok Janashakti Party, Chirag Paswan, has also found the best way to deal with the lockdown by giving a shave to his father, Ramvilas Paswan. He shared the clip with the caption, "Tough times, but see, lockdown also has a brighter side." And Union Minister for HRD, Ramesh Pokhriyal Nishank, has launched a web portal, Yukti. Now, Yukti stands for Young India Combating COVID with Knowledge, Technology and Innovation. Today, it's a unique portal and dashboard to monitor and record the efforts, initiatives of Ministry of Human Resource Development. The portal will cover various initiatives and efforts of the institutions in academics, research, especially related to COVID, social initiatives by institutions and measures taken for the betterment of the total well-being of students. It will also allow various institutions to share their strategies for various challenges that are there because of unprecedented situation of COVID-19 and other future initiatives.
मंत्रालय ने एक युक्ति पोर्टल तैयार किया है। ये युक्ति पोर्टल ऐसा प्लेटफॉर्म होगा जिसमें हमारी सभी संस्थाएं, चाहे हमारे आईटी है, एनआईटी है, आईसर है, आईपीएस है, मानव संसाधन विकास मंत्रालय से तमाम जुड़ी छोटी बड़ी संस्थाएं हैं, वो क्या क्या काम कर रही हैं और वो क्या क्या अभी तक उन्होंने अनुसंधान किया है, वो सभी इकट्ठा एक स्थान पर होगा। और वर्तमान परिस्थितियां जब पूरी दुनिया कोरोना वायरस के इस महामारी से जूझ रही है, इस संकट से उबरने के लिए ये तमाम संस्थान क्या शोध कर रहे हैं, क्या अनुसंधान इन्होंने अभी तक किया है, वो सभी जो उनके प्रयास हैं वो प्रयास एक स्थान पर प्राप्त होंगे।
India has gifted 5 lakh tablets of hydroxychloroquine to Afghanistan to fight COVID-19. Besides 251 containers carrying the first consignment of over 5,000 metric tons of wheat out of the total gift of 75,000 metric tons were sent to Chabahar port from Kandla port on Sunday. The remaining consignments will follow in the weeks ahead. A COVID-19 cell has been set up at Alapura district collectorate to monitor quarantine compliance by people and keep a check on their health conditions in real time through interactive voice response system. This is happening in Kerala in the COVID control room. Technology to reach out to a large number of people to provide them medical advice and assistance. Even in the case of community transmission of COVID-19, this cell can operate from remote areas. District administration is carrying out real-time intersectoral coordination and monitoring in view of coronavirus spread. The district collector mentioned that when Pathanamthitta district had 8 active COVID-19 cases, Alapura was able to keep the count at 3. Dr. Sharat Chandra Bose, in charge of COVID control cell in Alapura, said that all the people in isolation are contacted to know about their medical condition using IVR technology.
It's not possible to call each and every one of them every day and inquire for the development of symptoms. So we decided to implement the IVR system, the interactive voice response system, through which we can reach out to 10,000 people in maybe 3 or 4 hours, so that we can understand whether any one of them is developing symptoms, and we can take them for testing, and we can treat them and isolate them. In that way, we can contain the disease up to an extent.
The number of coronavirus cases continue to rise across the world. Over 18.48 lakh people have been infected across the globe due to it. The death toll has crossed the 1.14 lakh mark. The data is undoubtedly grim, but cannot be overlooked that more than 4.31 lakh people have also recovered from the disease. With over 20,000 casualties in the United States, US has the highest number of fatalities, followed by Italy, Spain, France and the United Kingdom. And the 3 distinct strains of COVID-19 have been identified by Dr. Peter Foster, a geneticist at University of Cambridge, and his team. They traced the origin of the pandemic by analyzing some 160 genomes from human patients. The team found that the strain in Wuhan, the hardest hit and the initial epicenter of the virus in China, mutated from an earlier version.
Virus mutates, it changes, and you get variants arising, and which is the original one. You find out that a location in the network, which we call type A, is the original type that would have infected humans. Then it mutated and changed into a type B. This type B was then the first genome to be picked up in Wuhan when the disease became apparent, and that is mutated further into C. Now, the C type is not found in the early phase of the outbreak in China. It is found outside. For example, it's well represented in Singapore.
The United States, which has become the outbreak's center of gravity after China and Italy, eclipsed the total number of cases in Italy and Spain as the country's confirmed cases reached 5,56,044. The casualties surpassed the 21,300 mark as it records 1,514 virus deaths in the past 24 hours. US President Donald Trump has declared a national emergency, and all 50 states have been notified with major disaster declaration, as more than 95% of the nation's 330 million population are under stay-at-home order. Meanwhile, United States church leaders peppered their Easter gatherings amid coronavirus. People took part in masses which were held online, on television, even in parking lots, to people sheltering in cars to maintain social distancing during the pandemic, as governors and health authorities across the United States have broadly asked residents to avoid any gathering in large numbers. And Italy on Sunday reported its lowest coronavirus death toll in more than 3 weeks. The 431 new deaths reported by Civil Protection Service were the lowest since March 19th. Italy's death toll now stands at 19,899, second behind the US. According to the officials, the number of people currently showing COVID-19 symptoms is still growing and has reached 1,02,253. However, number of people receiving emergency care has dropped. The number of people in non-critical hospital care has also seen a significant decline. Italy was the first Western democracy to be hit by the virus, and its lockdown has now been extended until the beginning of May. Police officers in Spain's Madrid paid tribute to health workers by playing music for them outside a hospital in a moment of relief from the coronavirus emergency. Health workers happily danced and clapped, holding flowers and signs after almost a month of lockdown in Spain. However, Spain's coronavirus death toll rose for the first time in 3 days on Sunday. A total of 619 people have died over the past 24 hours, bringing the cumulative toll to 17,209. Confirmed cases increased by around 2.6% to 1,66,831. Tough lockdown measures have helped bring down a spiraling death rate that reached its peak in early April. Meanwhile, all non-essential workers had been told to stay at home, but the government plans to revert less strict curbs that were forced up to March 27th. In the United Kingdom, the death toll from COVID-19 has risen to 10,612 across hospitals in the country after it recorded a daily rise of 737. The total number of infection cases has reached to 85,206. British Prime Minister Boris Johnson, meanwhile, was discharged from hospital yesterday. Johnson was taken to St Thomas's Hospital in London on April 5th. He was moved into the intensive care unit the following day and remained there for treatment until April 9th. Meanwhile, in France, the number of people who have died from the new coronavirus infection has risen to 14,412. The infection cases have risen to 1,33,670, as cited by the Health Ministry. Speaking at a news conference, French Public Health Chief Jérôme Salomon said the number of hospital fatalities rose significantly, although the number of people in intensive care units fell to 6,883. That's about 121 less than 7,004, marking the third straight day of the figure dropping slightly. The death toll in France from coronavirus outbreak rose at a slightly slower pace, suggesting that the lockdown was producing its effects. And Rio de Janeiro's statue of Christ the Redeemer was lit up on Easter Sunday with images of medical workers in honor of all those fighting the COVID-19 pandemic around the world. The giant statue of Jesus Christ that stands nearly 100 feet tall and overlooks the city of Rio de Janeiro was also visible wearing a doctor's uniform. Inspiring visuals coming in from Brazil. In China, the health authorities have called for concerted efforts to curb the new cases of COVID-19 as the country faces mounting pressure to tackle the rise in imported infections. National Health Commission reports 99 new confirmed coronavirus cases on the Chinese mainland, of which 97 were imported, almost doubling the 46 the previous day to a one-month high. And as the infection cases soar up, many Chinese cities are stepping up measures to prevent the second wave of infections by enacting stricter restrictions. Chinese cities near the border with Russia said they would tighten border controls and quarantine measures on arrival from abroad to curb the number of imported cases. The overall confirmed cases on mainland China have reached 83,134, and the death toll is at 3,343. Nepal has reported 3 new cases of coronavirus, and with this, the total number of cases has gone up to 12 in the Himalayan nation. Ministry of Health and Population spokesperson said that the condition of all 3 patients were normal at the moment and they are undergoing treatment in Birganj. He also informed 5,184 tests have been conducted in the country so far, including 795 samples tested in the past 24 hours. Spokesperson added that 7,973 persons have been kept in quarantine throughout the country, while 85 persons are in isolation. And Bangladesh Prime Minister Sheikh Hasina announced 5,000 crore taka special subsidized loan package for boosting agricultural production in the aftermath of the corona crisis. Prime Minister Sheikh Hasina said that refinancing scheme of 5,000 crore taka will carry a maximum interest rate of 5%. She said that a small and medium farmer will get the loan from this fund to use as current capital for use in agricultural and related activities. She also announced an additional 9,000 crore taka for fertilizer subsidy in the next budget to minimize the impact of corona pandemic on the agriculture sector in Bangladesh. Earlier on April 5th, Government of Bangladesh had announced a subsidized loan package of 72,750 crore taka for various other sectors of the economy. UAE government has announced 387 new cases of COVID-19. According to the Ministry of Health and Prevention, the total number of cases in UAE now stands at 4,123. UAE government has also announced recovery of 92 new cases after receiving necessary treatment, taking the total of recovered people to 680. The Health Ministry revealed 2 new deaths, taking the total number of casualties to 22. The government of UAE also said that they will review labour relations with countries not responding to evacuation requests of private sector expats after coronavirus outbreak. Meanwhile, Saudi Arabia has confirmed 429 new coronavirus cases over the past 24 hours, bringing the total to 4,262. An additional 7 deaths were recorded, bringing the death toll to 59 as on Sunday. Some other news: after the Indian security forces eliminated 5 terrorists on the line of control and 4 terrorists in hinterland past week, Pakistan Army resorted to ceasefire violations in Kupwara sector, the response to which was befittingly given by the armed forces deployed in the area, in which Pakistan Army and terrorists suffered numerous casualties. Yesterday, in a brazen, unprofessional and unethical act, Pakistan Army initiated unprovoked artillery fire targeting innocent civilian population, especially the poor Gujar villages where there are no presence of any armed installations or deployment. This resulted in death of 3 innocent civilians, including a woman and a child. Indian Army vows suitable retribution to this reprehensible act. British motor racing legend Sir Stirling Moss has died at the age of 90 following a long illness. He is widely regarded as one of the greatest Formula One drivers of all time. Even though he did not win the World Championship, he retired from top-level competition after a crash in 1962. He won an astonishing 16 Grand Prix in 1950s and early 1960s, 4 times a champion's runner-up, and also 3rd overall on 3 occasions. No other driver in the world has won as many races without taking the title. Stirling Moss, recognized as one of the greatest drivers, he was also the first Briton to win his home Grand Prix, beating Fangio Liverpool's Antre circuit for Mercedes in 1955. And with that, we conclude this bulletin. Take good care of yourself. Namaskar.